Foundation, Module 5, US Modular Integrated Undergraduate Curriculum Physiology. Dr. M. Ashraf Thind. Senior Demonstrator Sheikh Zayed. Medical College Physiology Department. Founder and CEO of Dr. Sheen, Medical Lecture. Super Fast Simplified Physiology. Video, Lecture Notes. Guytone and Hall 14. Edition Chapter, Number 38. Respiration, Pulmonary Ventilation. Lecture Number 7. Learning Objectives. 1. Define lung compliance. 2. Concept of lung compliance. 3. Value of lung compliance. 4. Compliance of thorax and lungs together. 5. Enlist the factors that affect lung compliance. 6. Compares and concept of the compliance diagram of the lung when filled with saline solution and when filled with air. 7. Draw the compliance diagram of air, filled and saline, filled lungs. 1. Define lung compliance. The extent to which the lungs will expand for each unit increase the transpulmonary pressure is called the lung compliance. Or, lung compliance is a measure of lungs' ability to stretch and expand when pressure is applied to them. It is the change in lung volume per unit, change in transpulmonary pressure. 2. Concept of lung compliance. Clinically, the ability of the lung to stretch is called compliance. Compliance refers to how much effort is required to stretch the lung and chest wall. High compliance means that the lungs and chest wall expand easily. Low compliance means that they resist expansion. By comparison, a thin balloon that is easy to inflate has high compliance, and a heavy and stiff balloon that takes a lot of effort to inflate has low compliance. You may have experienced something like this with old gym shorts. After many washing, the elastic waistband is easy to stretch, high compliance, but lacking in elastance, making it impossible for the shorts to stay up around your waist. Value of lung compliance. The total compliance of both lungs together in the normal adult averages about 200 milliliter of air per centimeter water transpulmonary pressure. That is, every time the transpulmonary pressure increases by 1 centimeter water, the lung volume will expand 200 milliliter after 10 to 20 seconds. Compliance diagram of the lungs. It is related. Lung volume changes to changes in pleural pressure. It changes transpulmonary pressure, transmural pressure. The relationship is different for inspiration and expiration. Each curve, inspiratory compliance curve and expiratory compliance curve, is recorded by changing the pleural pressure in small steps. The entire diagram is called the compliance diagram of the lungs. Elastic forces are involved in compliance of lungs, inspiratory compliance curve and expiratory compliance curve. These elastic forces are divided into two parts. 1. Elastic forces of the lung tissue. 2. Elastic forces caused by surface tension of the fluid that lines the inside walls of the alveoli and other lung air spaces. The elastic forces of the lung tissue are determined mainly by elastic and collagen fiber combined with other among the lung parenchyma. In deflated lungs, these fibers are in elastically contracted and kinked state, twisted. When the lungs expand, these fibers become stretched and unkinked, elongating and exerting more elastic force. The elastic forces caused by surface tension are much more complex. Compares the compliance of the lungs when filled with saline solution and when filled with air given below diagram. When the lungs are filled with air, this is an interface, boundary, between the alveolar fluid and the air in the alveoli. In lungs filled with saline solution, there is no air fluid interface, boundary, and the surface tension effect is not present. Only tissue elastic forces are operative in the lung filled with saline solution. Note: the transpleural pressures, intrapleural space pressure, required to expand air-filled lungs are about 3 times greater than to expand saline solution-filled lungs. Tissue elastic forces tending to cause collapse of the air-filled lung are 1/3 of the total lung elasticity, and the fluid-air interface tension forces in the alveoli are about 2/3. Compliance of thorax and lungs together. The thoracic cage has its own elastic and viscous properties. Even if the lungs were not present in the thorax, muscular effort would be required to expand the thoracic cage. The compliance of the lungs and thoracic cage, entire pulmonary system, is measured while expanding the lungs of a totally relaxed or paralyzed subject. To inflate this total pulmonary system, twice as much pressure is required compared with the same lungs after removal from the chest cage. The compliance of the combined lungs-thorax system is almost half that of the lungs alone, 110 milliliter per centimeter water pressure for the combined system, compared with 200 milliliter per centimeter water for the lungs alone. Enlist the factors that affect lung compliance. Lung compliance is affected by several factors, including 1. Elasticity of lungs. The lung's ability to stretch and recoil depends on the elastin in connective tissue. 2. Elasticity of the chest wall. The chest wall's ability to stretch and recoil affects lung compliance. 3. Surface tension. It is the force that holds liquid molecules together, for example, raindrops together, a tight contractile membrane of water, molecules around the entire surface of the raindrop on the inner surface of the alveoli, air-liquid interface in the alveoli. It is called surface tension elastic force. It is inversely proportional to diameter of the alveoli. When surface tension is decreased, radius is increased. 4. Surfactant. It is a surface-active agent in water that reduces the surface tension of water in the lungs and helps prevent alveolar collapse. It maintains the stability of alveoli. 5. Elastic recoil of the lung connective tissue. It is the tendency of the lung to return to its original shape after being stretched. 6. Restrictive lung diseases, e.g., pulmonary fibrosis. Restrictive lung diseases, such as pulmonary fibrosis. Lung compliance is decreased due to stiffness or scarring of lung tissue. 7. Emphysema or chronic obstructive pulmonary disease. Emphysema, COPD, may be associated with an increase in pulmonary compliance due to the loss alveolar and elastic tissue. 6. Compares and concept of the compliance diagram of the lung when filled with saline solution and when filled with air. When the lungs are filled with air, there is an interface between the alveolar fluid and the air in the alveoli. For air-filled lungs, increased lung volume, pleural pressure, will have to increase to minus 7.5 centimeter water 2/3 of the fluid, air surface tension forces in lungs. When filled with saline solution, 0.9%, there is no air-fluid interface, only saline solution is present. It does not create surface tension, no tendency of collapsing lungs, 1/3 of total lung elastic forces, and easily expand and compliance. Minus 2 centimeter water increases because there is no air-fluid interface, so there is little difference between inspiratory compliance curve and expiratory compliance curve. Given saline-filled diagram. Note that transpleural pressures required to expand air-filled lungs are about 3 times greater than required to expand with saline-filled. 7. Draw the compliance diagram of air, filled and salines, filled lungs.